when you're moving from place to place. Good morning, good morning, morning, good morning, morning.
And we are back here on Tobago Updates, Youth Wednesdays. Dwayne, we started off with some very informative, information.
Yes, from
is what I should say. Yes, from Dr. Edabo, right? And we continue on from a different perspective, and that is to speak to the patient, right? We have with us this morning Mr. Hayden Duke. Good morning to you, sir. I mean, he's looking a bit nervous. Are you okay over there?
I'm fine.
You're fine?
Yes. Mr. Duke could handle himself, right? He's a Duke after all, right? But good morning to you.
Good morning.
It's a pleasure to have you.
Yes.
We have cancer survivors, and then we have stroke survivors.
That's correct.
We've just heard from Dr. Edabo the intricacies of a stroke, right? Oh. Did you ever in your lifetime think that at your age you would suffer a stroke?
Definitely not. At the time that it occurred, I would say in the peak of my life. You know, I was just about getting ready to celebrate in my mind my 40th birthday, planning a big bram. And April 11th of that year, the snap and everything just went literally dead.
Right.
So no, I wasn't looking forward to anything like that.
Wow. What was your lifestyle like? Were you? I don't want to ask what your profession is, but holistically, when you look at your life, would you say that you are very active? Would you say that you would have reduced the backyard gardening? What would you say? Your life was like before this?
My life basically would have changed a lot. And when I say that, I was an avid football player, coach, did a lot of things during that time in my youthful years. And not that I'm old now, but nonetheless, there were many things that I was involved in at that point in time. I literally at that point as well, when it happened, was working probably about 20 hours per day, right? Wasn't eating right. I must confess that I am an avid Coke drinker. Coca-Cola. Let me get that right.
Let's
get that right.
spell that out.
Right. And my diet wasn't right. I got into administration where football was concerned, and I stopped all exercising, stopped playing all the football and the such like. So I know a lot of lifestyle changes would have happened with me at that time.
Okay, and based on the information that we just got from the doctor in our previous interview, are you aware of the type of stroke that you had?
Yes.
Yes, and what type of stroke?
Right. It was a transient ischemic attack.
Okay.
Right, which is a minor stroke, but nonetheless, just as much. It did cause some damage.
Okay. And how were you aware that you were having the stroke? So we're going through the process now.
Sure.
When the stroke first appeared, so to speak, how did you know that you were having a stroke? What were the signs and symptoms that you saw?
It was a regular day for me. I went to work, sat down at my desk, and I just got this searing headache. And took myself out to casualty. And after blood pressure testing, everything on my left side just went dead.
Okay.
I didn't have the opportunity to check on slurred speech or anything like that. Everything just literally went dead on my left side.
Okay. And what was the process like after suffering through the stroke? What was it like going through casualty? What was your recovery like? What happened between recovery and casualty itself?
Casualty, the medical professionals took care of me.
Yes.
Pretty much very well. I would say kudos to them always, because that is what they always attempt to do and do to the best of their ability. What happened from casualty to recovery was a lot of changes, right? Lifestyle changes, first and foremost, having to make sure that I take my medication and try to get in some exercise. So those things were very, very much important in terms of the recovery. I did have a lot of help from the area that I worked in, which is physiotherapy. Yes?
Okay.
They helped me a lot in terms of my recovery.
Okay. So I was just about to ask about the physiotherapy aspect. I know we have a professional coming to speak to us after, your interview.
Sure.
But on the patient side of things, how easy or how hard it was to go through physiotherapy itself?
What can I say? They are professional in what they do, right? And I would tell you that they drilled me because it wasn't an easy thing to relearn to walk in a real sense, much less to run and go back and play football as the case may be. It took a lot from me mentally because, I mean, I'm in the profession as well.
Yeah.
And I had to see patients, what they go through, and imagine myself having to go through that. So mentally for me, it was a really big deal. Thankfully, because of what I knew in the profession, I got up off my butt and did the things that were necessary.
All right. And how did this stroke affect your life? Your life at work, your life at home. I don't know if you're married, I don't know if you have a girlfriend, right? How did it affect your life, and how did you cope mentally, knowing as a man, as a Tobago, you know, we Tobago men are the real pride. Going to the hospital is a big thing for we, right? How did you cope with that and maneuver that pridefulness, that egotistical, quote unquote, Tobago pride that we have in terms of recovery and being a victim of stroke?
No, I don't think it has anything to do with Tobago. A man has to be a man.
Yes.
At the end of the day.
Yes,
and
Dwayne.
taking care of my family was one of the most important things.
We have to big up the Tobago man.
Well, all right. Yeah. Well, then yes, the Tobago man from that perspective. But yes, it was a challenge. I had to see my children watch at me in a particular way. Yeah. And to try to see how best I could not let them feel what I was feeling. So it was a challenge, but however, I believe in the Most High.
Yes.
Right? And he was a great part in making sure that they supported me the way that I needed to be supported. And in return, I gave it back to them.
All right. Was there any pain, right, in moving? Did you suffer any pain on the day itself, on the day of the stroke? And were there any pain during the process?
Well, besides the very strong headache that he had.
Yeah, besides that, yeah. Was there any pain in the body?
There was limpness.
Okay.
Right? So that in itself, it was difficult to struggle to move my leg, to move my hand, as the case may be. The pains that resulted from that did affect me. Yeah.
Okay. Before we close, what are some of your aftercare procedures like now? So at present, you know, you look like you are fully recovered. I see, no, personally, I don't see any signs of you having a stroke all entirely. So what was your aftercare procedure like? What do you normally do on a daily basis now to help you through any processes that you have to
if
do?
my doctor is going to see this, I'm not going to mix it up. Right? But nonetheless, exercise is a must. Exercise is a must. Eating right is just as paramount. You know, every day you just do what you have to do, taking your medication. Right? Those are the important parts in ensuring that you recover well. Right? Forget the snacks, especially the snacks that has MSG and those corn kernels. Forget those things. Those things are not important in your life, right? They are fruits and vegetables. Those are the things that you should be focusing on more than anything else.
Okay.
And let me just put this out there. I didn't just recover from one. I recovered from 3.
3.
Wow. Right? Wow. Most persons are not going to see it, but I do have a little bit of a struggle still with my left leg, but because I walk fast, persons will know.
Okay. All right. And physiotherapy played a big part in that.
Oh, definitely.
Yes.
We won't talk about the professional that is here, but yeah, he did a lot in terms of helping me.
Well, we are about to speak to him, right? So for stroke patients that may be out there and seeking that type of medical attention, we have our physiotherapist to come and speak on that topic today, right? So, Mr. Duke, I want to thank you so much for being with us here on Youth Wednesdays on Tobago Updates. I mean, I do really hope that you enjoy the rest of your day. Thank you for the advice to the younger generation. I myself am taking it into consideration. That is exercise and getting rid of my snacks. Okay?
And when you're stressed.
You sound very much hurt by this transition. But, you know, there is a God, Miss Nancis, who will help you get over your snacks.
Yes. I believe that he would.
So guys, this brings us to the end of this segment, and we're going to be talking to Mr. Wood, R. Wood, right? To come and talk to us about the recovery part of the stroke from a physiotherapist perspective. Remember to
share the life, share the life, share the life. We'll be right back.